If you're trying to memorize every little detail about the counseling theories, it's probably not going to stick, and it'll likely explain why you're having a hard time with the theories questions on the exam. A lot of people think passing this exam means knowing the definitions to everything, but it's not. It's about knowing how the theories actually show up in the questions. Hi, I'm BC. I'm a licensed therapist, and I help people pass the NCMHCE. This is one of the biggest things I see people struggle with and need help understanding when they first start preparing for the exam. So let's talk about how to understand the theories in a way that not only makes sense, but helps you be successful on this exam, especially because theories makes up 30% of the scored questions on this exam. Most people study the theories like this. They're reading long textbook chapters, they're memorizing definitions word for word, and they're trying to remember every detail about every single theorist or creator. And that's a problem because that's not how this exam is testing your knowledge. So sure, you'll end up knowing a lot of things, but it may not be enough to help you pass the test. And you'll find yourself still second guessing all of your decisions. The test is not going to ask you, what is a CBT? But they may give you a question like this. Using a person-centered therapy framework, what will you focus on in therapy to facilitate the best treatment outcomes with this client? A, assessing the client's motivation to make positive changes in her life. B, fostering the client's self-exploration and gain insight into her feelings, beliefs, and behaviors. C, externalizing her problems by separating them from her identity. Or D, helping the client accept her feelings, thoughts, and experiences without judgment. So instead of trying to focus on everything for the theories, here's what you should focus on instead. I have 5 things I want you to keep in mind. Number 1, know the theorist's name or names, because sometimes it is more than one person who founded it. Here's an example of it. So you don't need to know where they lived, when they founded the theory, what kind of clinician they were, any of those things. Really just be able to connect the name with the theory, because sometimes the name is all they'll give you. The second thing is to know the main idea. This can also be called the goal or the objective. But if you can only focus on one thing about the theories, let it be the main idea. This test loves those questions, and if you can at least know the main idea, it makes it easier to navigate some of those other questions. This question from earlier is a perfect example of this. Using a person-centered framework, what will you focus on in therapy to facilitate the best treatment outcomes with the client? A, assessing the client's motivation to make positive changes in her life. This is motivational interviewing. B, fostering the client's self-exploration and gain insight into her feelings, beliefs, and behaviors. That one is person-centered. C, externalizing her problems by separating them from her identity. That one could be narrative therapy. And D, helping the client accept her feelings, thoughts, and experience without judgment. That one is acceptance and commitment therapy. The third thing is to know the techniques. And I'm not just talking about memorizing definitions. I'm talking about actually being able to see it in a question that has answer choices that are just examples of that being used. This question here is a great example of this. When using a cognitive behavioral strategy, what would support increasing her sense of agency? A, reviewing homework exercises regularly to help her learn as much as possible. B, ensuring that she learns how to practice techniques to help her cope with her anxiety. C, facilitating discovery of options to help manage her concerns while concurrently learning to be her own therapist. Or D, emphasizing a focus on restructuring negative thought patterns as a coping skill. Those had multiple CBT answer choices that all sounded good, but were from different techniques. So make sure you know if it fits that theory, but also know is it actually answering the question. The fourth thing to think about is the therapist themselves. For this test, we need to think about by the book as originally intended. In real life, you're probably mixing and matching interventions with your clients, but for this test, if they're asking us to use a specific theory, we're just focusing on that. So then you want to be thinking about, how is this kind of theorist or therapist showing up in the room with the client. I find it helpful to think of the theories as a spectrum. I would put person-centered on one end and CBT on the other. A CBT therapist is very direct. It is a therapist-led approach. So this therapist would have no problem confronting the client, calling them out, redirecting them to a different way of thinking. Person-centered is the complete opposite of that. It is a client-led approach. So here, we're still going to ask questions and figure out what's going on with the client, but we're not trying to get them to think of things in a different way. So when we're thinking about how the therapist shows up, we're thinking about client-led or therapist-led, hands-off or more direct and hands-on. That way it'll help us navigate these questions. The final thing to keep in mind is when you should and should not be using that theory. Some theories were created for specific disorders. For example, DBT or dialectical behavioral therapy was created for borderline personality disorder. It's used for other things now, but that's one of the main instances you'll see it come up. Others are good for a variety of things like grief, substance use, anger issues, career problems, variety of things. But some theories also have limitations or instances when you should not use that theory. So thinking about when a theory will or won't be effective is going to help you a lot, because there will be times where the exam asks you to pick which theory to use with that client. Knowing the main idea will help a lot, but you're also going to need to know whether it's effective. As you start focusing on those 5 things, you'll start to see patterns. You'll be able to look at those answers and go, this one's talking about values. So we're probably looking at acceptance and commitment therapy or ACT. Or this one's focusing on just behaviors. It's not talking about thoughts at all. It's behavior therapy. Or you might also look at the answers and go, that approach is way too direct. A person-centered therapist is not acting like that. And as you start to find those patterns, it'll get easier and easier for you to understand what the test is asking you and feel more confident in your decision making. You want to make sure you're not trying to cram everything in at once. I encourage people to give themselves at least 3 months of prep time before this exam, and we're spreading the theories across 10 weeks of those 3 months. So then we can use the last 2 weeks to review all of our notes. So week 1, do 3 to 4 theories, review it at the end of the week. Next week, add in 3 to 4 more theories, review all of the ones you've gotten so far. You want to keep it fresh to still recall the information afterwards. Please don't try to memorize it all weeks before your test. It will be a lot. Especially because I find that this test likes to set traps. They'll put answers that sound good or helpful to the client, but don't actually answer the question. So you want to be in the habit of looking carefully and feeling solid in your decision making. I know this can be pretty overwhelming, and I actually have a theory study guide for you that is from my personal notes when I was preparing for the exam. It helps you understand what's worth focusing on, it breaks it down in a way that makes more sense, and it'll help you start applying it to the exam. So if you've been feeling stuck with the theories, this will definitely help you out. I'll link it in the description below. But whether you use my study guides or not, please keep in mind the things I shared in this video. You gotta break down the theories. You have to make sure you understand it yourself instead of just memorizing it. That's what's going to make a real difference on this exam.